Question 71. Seminal vesicles and prostate. Seminal vesicles are accessory glands of male genital system. They are two elongated sacs, about 5 centimeters long. They are laterally to the deferent ducts and behind the bladder and in front of the rectum, in the rectovesical septum. The upper part of vesicle is covered with peritoneum, and the duct of vesicle joins with deferent duct to form ejaculatory duct. So it empties into the prostatic part of urethra. The blood supply is branches of inferior vesical artery, middle rectal artery, and artery of deferent duct. The nerve supply is by the pelvic autonomic plexus. Now the prostate is also an accessory gland. It is situated in the lesser pelvis, behind the lower part of symphysis, and it is in front of the rectum and below the bladder. It's conical in shape and has a base that is directed upwards and related to fundus of bladder. It has an apex that is directed downwards and is in contact with the urogenital diaphragm. And it has a posterior surface related to rectum and is perforated by ejaculatory duct. You can also see the ejaculatory duct related to rectum. It has an anterior surface that is separated from the symphysis by plexus of veins and areolar tissue, and is connected to the pubis by puboprostatic ligament. The inferolateral surfaces here are related to pelvic diaphragm, levator ani muscle. Now the prostate is divided by the urethra and ejaculatory ducts into the middle lobe, the right and left lobes, and isthmus. The prostate is enveloped by a prostatic fascia or capsule of fibrous tissue, and this is continuous with fascia of pelvic diaphragm on the sides, with the perineal body behind, and in front with the puboprostatic ligaments. The blood supply is by the branches of middle rectal artery and inferior vesical artery. And nerves are derived from the pelvic autonomic plexus.